Hello, I'm Anieshvari. I'm doing Strabismus Fellowship in Indian Optometry of Council. I'm working as an optometrist in well-established hospital. Now we are going to do Strabismus evaluation based on deviation, based on committancy, based on position of corneal reflex and cover test. Now let's see based on direction. Exotropia, outward deviation. Esotropia, inward deviation. Right eye hypertropia with primary IO overaction. Now based on committancy. In committant strabismus, angle of deviation will be same in all 9 cases. In incommittant strabismus, angle of deviation varies with direction of gaze and or with eye used to fixate. Examples of incommittant strabismus: left eye third nerve palsy, left eye restricted adduction -1, restricted -4 elevation and restricted -4 depression in left eye, congenital SO palsy. Position of corneal reflex. So if the corneal reflex in center of the pupil, it is no angle. If the corneal reflex in pupillary margin is 15 degree, if it is in between pupil and limbus is 30 degree, and on the limbus is 45 degree, reflex out of the limbus recorded as more than 45 degree. Modified Krumsky. Right eye XT 15 degree and right eye mature cataract. Placing prism in front of left eye to measure the deviation of right eye through corneal reflex. Cover test. Direct cover test. Cover uncover test to find latent deviation. Alternate cover test. Prism cover test to measure the deviation. A 18-year-old girl presented with complaint of noticing squint while viewing on lateral gaze, and it has been noticed by her friends, and complaint of abnormal head posture. Her vision is 6:6. Sensory evaluation. Watford dot test for distance, binocular single vision is present, and for near, binocular single vision is present, and with stereo acuity 60 seconds of arc. And her corneal reflex is no angle. On extraocular movements, left eye abduction restricted -2, and globe retraction in left eye is noted, with palpebral fissure changes, and it narrows on adduction and widens on abduction. On cover test, esophoria is noted. On prism cover test for distance, measuring primary deviation by fixing right eye and placing the prism in front of the left eye. The distance deviation is 14 pdet. And the secondary deviation fixing left eye, and the deviation is 25 pdet. For near, the primary deviation is measured as 8 prism esotropia, secondary deviation is measured as 14 prism esotropia, and the diagnosis is left eye Duane's retraction syndrome type 1.